All right, hello everyone, and welcome to Rev Cycle Ready. This is our Rev Cycle 101 presentation. My name is Johnny Holmgren, and I'm excited to jump in and get going on this. So, just to give you an idea of what the presentation is going to cover today, we really want to cover, what is the revenue cycle? Why is this so important? And then we're going to jump into the bulk of the presentation is going to cover what is the process of the revenue cycle. All right, so what is revenue cycle management? Think about it from the perspective of how does the healthcare organization get paid? So you have the patient, they get registered, and then there's a bunch of different steps in between from registration until you finally get paid. That is your revenue cycle process. Obviously, if you have a more effective revenue cycle, it means you're going to be generating more revenue for your organization. And the revenue cycle is broken up into three different areas. You have your front end, your middle, and then your back end. And we're going to be diving into these three different areas of the revenue cycle today. But before we do that, I think it's really important to gain a good background understanding of revenue cycle. So why is it so important? So there was a study done by Micro Market Monitor, and they did a market valuation analysis of revenue cycle management. And in 2014, they valued the market at $18.3 billion. Just last year, 2019, it jumped all the way up to $32.2 billion. So the market for revenue cycle is soaring and is continually, is expecting to grow continually moving forward. Additionally, Cardinal Health, they just barely released a study asking 150 different hospital administrators, what are some of the biggest problems that are facing healthcare organizations today? And the number one response back that they got was reimbursement. Given some of the complex policies and procedures that healthcare organizations have to go through that are put on them from the payers, it's just a very complex process and very, very, very difficult to get the money that you have earned. And so that was by far the number one response, followed by high cost of supplies, good leaders and effective management, and then having a good supply chain system were also other responses. Additionally, the rev cycle process is really, really important for healthcare organizations because there's a pretty significant financial impact. So based from CMS in 2017, nearly 70% of all claims that a healthcare organization sends out to the payer are actually paid the very first time that they are sent out. This is oftentimes called a clean claim, and if it's if payment isn't sent back on the very first time, but instead a denial is sent back, then it's not a clean claim, it would be a non-clean claim. So like I said in the last slide, given that 70% of the time the claim is going to be clean, 30% of the time it's going to be a non-clean claim. And that's either going to be because the claim was denied or it ended up being ignored by the payer. The crazy thing is that when the healthcare organization gets these denied claims back to them, of these non-clean claims, 60% of the time they're not resubmitted. And so medical practices never collect on 18% of the claims that they end up sending out to the payer. But that's not all. Just because you get paid doesn't necessarily mean that you get paid in full according to what is in your contract with your payers. So MGMA, or the Medical Group Management Association, they estimate that payers actually underpay practices in the U.S. by an average of 7 to 11%. So if we lowball it and say that there's a 7% on average underpayment, and we add that to the 18% of claims that healthcare organizations aren't even getting paid on at all, that means that medical practices are failing to collect, on average, about 25% of the money that they've earned actually treating patients. So to kind of give you a simplified example, let's say that you owned a restaurant and you had a customer come in and they ordered a bunch of food and ended up costing them $100. They end up, you give them the bill for $100 and they only give you $75. And that's it. There's no going back to the customer and trying to get more money, and that's it. You just collect 75% of all your money. It's wild. And so that's one of the reasons why making sure that you have an effective revenue cycle process is so important for these healthcare organizations. It's because they've earned the money, but they just haven't received it. And if they don't have a good revenue cycle process, then they can't receive it. And this ends up being really significant when you aggregate this across all the different healthcare organizations across the country. In fact, it ends up equating to $125 billion that is completely left on the table every year by American medical practices and healthcare organizations because of ineffective revenue cycle processes. Right, so everything touches the revenue cycle. So all clinical and non-clinical work is in some way going to be associated with the revenue cycle. And all executives understand these concepts. And if you ever want to become one, it's really important that you understand revenue cycle. In fact, by having a very solid foundation of these principles, you'll be able to provide insight in how money flows in and out of the organization. And understanding these concepts is going to get you a seat and a value perspective at every single meeting in the organization. So you have a pretty big opportunity, whether it's at your the organization that you're currently at, or maybe you're a student, you're looking at your first job, or maybe looking at another organization. The question that we want you to be thinking about as you're going throughout this course is, how valuable are you? If you can help your organization capture some of that 25% of money that they've earned, but they're not currently collecting. If it's just 1% or even 0.5%, that can be a gigantic sum of cash that the organization is able to collect, and is going to help them to obviously become more financially viable and continue to add value and deliver care to their patients so they can be able to fulfill their mission, vision, values, and the goals that they have. So now we're going to jump in and actually learn all of these really important concepts. So there's really 3 stages in the revenue cycle. You have your front end operations, you have your middle section, then you have your back end operations. So we just kind of want to bring up a kind of a fun little example. If you think about, and we kind of already talked about food earlier, and so we're going to stay on that topic, but think about the rev cycle in fast food. Okay, it's so stupid simple. All right, so your customers, they order food, and then the food is exchanged for payment. That's it. There's really no process in between those two things. You order your food, you get your food, and you give them the money. Pretty simple, right? Well, the revenue cycle in healthcare is slightly more complicated. So Curtis and I, we've listed 11 major checkpoints that occur in the revenue cycle process in healthcare. But even between those points are subpoints and actions that need to take place. So it gets complicated very quickly. And this is the process that we're going to be dissecting in our presentation today, going from that beginning into the middle and into the and then finally into the back end of the revenue cycle process. So we will first start in the front end. All right, so the registration process allows the provider, which could be a doctor, a physician assistant, or a nurse practitioner, to obtain all the necessary information and insurance information that they need in order to bill the insurance company. So this process is most often going to be conducted by individuals that are working at the front desks of healthcare organizations, or maybe even those that are, if you're working in a scheduling department, taking calls, they might be the ones collecting some of this information too. So this stage is extremely important. In fact, a lot of errors that are made during the registration process are one of the biggest culprits that cause non-clinical denials from your payers. So when the patient gets registered, the following documentation needs to be collected and verified. So it can be things like your date of birth, your social security number, an address, information from your employer, your insurance, your policy number, and then a reason why you're coming in. And in fact, if you don't collect all this information, it can result in having a denied claim. All right, step number 2. So insurance verification, clearance, and POS collections, which stands for point of service collections. And we'll dive in and explain what that means. So the scheduling and registration clerk is going to be responsible for assuring that your patient has financial clearance so that you can begin the patient collection process. So money that's collected at the beginning of the rev cycle process is going to reduce the work that is required on the back end of your revenue cycle process. So it's really important that the front desk individuals that they do could try to collect payment, even if it's just a few dollars. Sometimes this is often called a copay, and sometimes a copay is going to have a finite number attached to it. Other times, your front desk people, they'll good best practice, just say, hey, what can you pay? What can you pay today, right? And then a very important rev cycle metric that's often used within the industry is going to be POS cash collections, or point of service cash collections. So POS cash collections, it's kind of a mouthful. So this is going to be calculated by taking your POS collections and then dividing that by your total collections. So industry average has your point of service cash collections making up about 3% of your total payments or collections. So number 3, compliance and pre-authorization. So part of the shift to value that payers and other policymakers are requiring is to require higher quality care at more competitive prices. So healthcare organizations are now required by law to make their pricing list public, and that's kind of been something that's been a big deal. I actually don't think it's very significant, because the price listed on the charge master isn't indicative to what the patient is going to pay. You could charge $1 million for a service, but when you send that claim into the payer, they're going to look at their contract and say, well, we've contracted to pay you $100. You can charge whatever you want. You're going to have to write off the difference. We're going to be paying you $100, and the patient has their portion as well. So having healthcare organizations be required to publish their charge master list isn't that big of a deal, right? What we need, and this is just my opinion, is that it'd be nice if, would be nice if the payers were more transparent with their servicing contracts. Now, this would be a lot more accurate representation of what the patients would need to pay. Okay, great. So greater compliance is mandatory. So additionally, government is calling for a pretty strict compliance to anti-kickback laws, civil monetary penalties, false claims, and also like safe harbor laws. So we're not going to dive into a lot of those today, but essentially, failure to comply to a lot of these different policies can result in large penalties. So it's really important that as we go throughout this rev cycle process that we're being compliant. And all the staff from the front end to the back end of the rev cycle process, they're going to be trained on these compliance topics. Pricing, however, is going to be assigned specifically to your registration or scheduling clerk. So let's see, what else? Okay, pre-authorization. So pre-authorization, so this essentially is the requirement from your health insurance company that your provider needs to obtain approval from the plan before it will cover the costs of not every service, but just a specific medicine or devices or certain procedures. So if you don't get authorization from the payer, then they can send back a denial and say you didn't have, you weren't approved to be paid on this specific service. So it's really important that your healthcare organization, that they reach out to the payer before scheduling takes place with the patient to to approve certain procedures or services. With that, we are done with the front end process of the revenue cycle, and we are going to be moving into the middle process. All right, to start off the middle process of the revenue cycle, we have number 4, which is our clinical documentation. So when the patient goes and sees the provider is going to be responsible for documenting what happened during the procedure or the service. So they enter the appropriate charge and any information associated with that service into what's called an electronic health record, or an EHR. Sometimes this is also called an electronic medical record or an EMR. The two are synonymous. So if the provider fails to document something, or maybe they incorrectly put something into the EHR, this can result in unbilled claims, denials from the payer, and eventually lost revenue. So really important that you have good clinical documentation in place. All right, moving on to number 5, coding. So once charges are documented, the next step is to support those services through coding and complete documentation. So providers, they need to provide specific documentation for why a particular service was required. Additionally, how the service was performed, and any diagnosis codes or supplies codes that are going to be associated with that service. And we do that through having coders and any other support staff who are going to verify the coding. They have certain codes that are associated with the entire process of that service. So we have a few different type of codes. We have your ICD-10 codes, which we're not going to go too deep into these, but they can be your diagnostic or your inpatient procedure codes. Your CPT codes, which generally are just going to be your outpatient procedures, and then your HCPCS, which is going to be your supplies codes. So the middle section of the rev cycle process is relatively short compared to the front and especially the back end of the rev cycle, and we will now move into that section of our presentation. All right, number 6, claims processing. So this is essentially taking the claim that you have developed at your healthcare organization and getting it sent off to the payer so that they can process the claim and send you the reimbursement that you've earned. So once the encounter is closed and all documentation for the encounter has been received, then the claims process can begin. The goal every time is you want to submit clean claims to the insurer. And like we talked about earlier, the clean claim includes all the necessary information and documentation for the payer in order for them to be able to process the claim. Now, if you have a 90% clean claim rate, that means that you're running a pretty good rev cycle operation in both your front end and your middle sections of your rev cycle. So that's just a target that you ought to be shooting for. So for any inpatient billing, you're going to use the UB04. So it's going to contain fields for your demographic, for the patient demographics, any provider facility information. Let's see what else. The date that the service was rendered, any coding information, and then obviously your patient's insurance information. And this is going to be used by all inpatient billing, so your hospitals, nursing facilities, and let's see, any other facility providers. On the other hand, for your outpatient billing, you're going to use a HCFA 1500. So this is going to be a medical claim form by or for employed or individual doctors and practices. This also includes your therapists, chiropractors, or any outpatient clinics. It'll be very important that from this point moving forward, to know that all of your billers and coders, they're going to be the ones that are overseeing the entire back end of the rev cycle process. Extremely important that you have good policies and processes and individuals in these positions, because while even if you have good claims, if you don't have people that can handle a lot of the back end process, you're not going to get paid. So after we've sent off the claims to the payers, it's now our job to make sure that we're managing those claims and making sure that that we stay on top of them. So claims management is the organization, billing, filing, and updating of medical claims related to the patient's visit or service. Because maintaining patient records and interacting with the health insurance agencies and issuing invoices for medical services are pretty time-consuming responsibilities, a lot of hospitals and other healthcare organizations are going to outsource these tasks to medical claims management firms. And if you don't have effective medical claims management, then patients wouldn't know what they owe, and then medical facilities aren't going to be able to receive the funds that they are owed for patient services. So super important that you have some sort of process in place, whether that be a good process internal or whether it be outsourced. The role of your contract management is going to ensure that the payer contracts are going to be up to date, that they're well negotiated, and that the provider is given fair reimbursement. Best practice is you want to review all your contracts annually to ensure that no revenue is left on the table. Oftentimes we've met with some healthcare organizations and they haven't updated their contracts in like 7 or 10 years. And I mean, just keeping up with the rate of inflation, you need to adjust your contracts, but there's so much constantly changing in the healthcare landscape that if you're staying on top of your contracts every year, you're going to be in good shape. Okay, so also during number 7, during this stage, also very important to correct any errors that you have on denials that are getting sent back to you, and then try to resubmit those claims. All right, number 8, AR or accounts receivables management. So AR is extremely important in a rev cycle process. And to have individuals assigned to continually be working on open AR is very important. Now, if you have, I guess let's first define what is AR. So AR is really essentially the difference between what you've been paid and what you're still owed by the payer, whether that be your healthcare insurance company or by the patient. And actually, just following up is a great best practice to work down some of that AR. Reaching out to your patient and saying that they still have their portion that's still due, or continually following up on claims that you've submitted to your insurance companies is a great way to do this. And in fact, a lot of systems have the ability to automatically set up a notification process when a claim is either a month, 2, or 3 months old to send the billers a notification saying, hey, we need to follow up on a certain claim. AR follow-up is going to be most common with self-pay patients, or when the patient's insurance company has refused to pay their portion of the bill and it's going to fall on the patient. Now, if your collection attempts fail, the balance is either going to be written off completely, or it'll be sent over to a collections agency, and they're going to charge a fee to try and collect that open AR. All right, number 9, denials management. So when a claim gets submitted to the payer, a few different things can happen. Either the claim is going to be granted, and the insurance company is going to pay the healthcare organization for that claim. It can be held until further information is supplied, or it can just be straight denied and be sent back to the healthcare organization. When this happens, this is called a denial. So a denial is the refusal of an insurance company to honor the request of a provider to pay for a particular claim or a service. So having denials management processes in place can help identify issues within the revenue cycle that lead to denials. So, for example, if we're having a pretty significant timely filing issue and we're getting a lot of timely filing denials, having denials management processes in place that try to identify something like a timely filing issue can then help us do a root cause analysis and try to figure out, okay, why are we having this big timely filing issue? And as you drill down, you can be able to eliminate the issue and then decrease the amount of timely filing that you're having. So that's just an example of how denials management can be an effective process in the revenue cycle backend. Number 10, transaction posting. So this is essentially when you receive the claim back from the payer, you need to post that claim or that transaction to your general ledger or to maybe a billing system. So there's a lot of administrators that look at the front and the middle parts of your rev cycle, like your coding and your clinical documentation, as the key drivers for good rev cycle management. And they might consider transaction posting just to be a process of just posting your payments. However, a good payment processing team can provide really critical insights into the overall effectiveness of your rev cycle process. So once claims are approved, it's really important to post the payments in a timely manner, because debts and other things are being incurred constantly. When payments are not posted quickly, additional fees can be tacked on to the hospital's debt balance. All right, number 11, and the final step of our rev cycle backend process is benchmarking and reporting. So if we're going to improve any process in healthcare, it requires a benchmark. We can show someone that we made $10,000 today, but is that good? We need some sort of comparable in order to analyze that and say, is that good or is that bad? So make sure that we have good benchmarks, and setting goals to reach those benchmarks is something that's important to have in your rev cycle process. In fact, it can actually lead to an additional percentage of reimbursement from government payers, or even a penalty. So with a lot of the government policies that have been put into place with the Affordable Care Act, pressures to deliver high quality affordable care to healthcare organizations, and specific in hitting certain rev cycle benchmarks, gives healthcare organizations, like I said before, the opportunity to either receive an additional percentage or penalty if they're not hitting certain benchmarks. So being able to establish good benchmarks and report on those benchmarks is a very important process in the back end part of our rev cycle. All right, to give a quick summary of everything that we've learned today. So first off, reimbursement is a major concern for most healthcare organizations across the country. With the passing of the Affordable Care Act and the ambiguous future of what healthcare looks like in the United States, making sure that healthcare organizations are paid on what they've earned is extremely important for their financial viability and their commitment to provide healthcare to their population set. Next, revenue cycle management is growing. It's growing a ton. Just looking at some of the statistics that we saw, it's grown by $14 billion in the last 4 years, and is continually growing. So big opportunity to help organizations to run effective rev cycle processes. Like we talked about, a lot of the complex policies and procedures make collecting net patient service revenue very difficult. And running an effective rev cycle is key to working down some of your AR and capturing the money that you've earned as a healthcare organization. And then really just understanding these 11 steps and the subpoints and the kind of the shoots off in the different directions with each of these 11 points. It's just really important if you want to be a real value adder and a contributor in your organization. With that is the end of our Rev Cycle 101 presentation. Thank you so much for joining in. I hope you enjoyed it. If you have any comments, I'd love to hear them. If there's any ways that you feel like we could improve this, or if there's any information that you feel like is valuable that we didn't cover, please reach out to us. Let us know so we can include it in future content. On top of everything that we've gone over today, we want to invite you to check out some of the other content that we have available. We try to make this as valuable to you as possible, and in a lot of the examples, it's essentially teaching you how to take a report that that Curtis and I have created and help you to replicate that for your current organization. So be sure to tune into some of our other material that we have out there. And with that, once again, thank you so much for joining in to Rev Cycle Ready and this presentation today.